This is Robin Brandt at Pacific Basin Rehabilitation Research and Training Center. We want to welcome you to our webcast on statewide services. And this morning we have Debbie Jackson from the Disability Communication Access Board to discuss what her agency offers across the state. I want to mention that we're recording this, so we will be able to play it back in the future. If you have any questions as we go along, please feel free to type them in. We will stop recording. We will be I'm sorry, I'm being distracted because it says it stopped recording. Is there a reason?
No, that's what you do to make it stop.
Oh, okay.
Should be all right.
Sorry, I still have to get used to this too. At any time, if you have a question, please type it in, and we will get to it one way or the other. At the end of the session, if there are still questions remaining, we will get answers to them and get this information up on our website. Thank you so much for participating. I'm going to hand this over to Debbie Jackson.
Good morning. I was explaining to Robin this morning that this is the first time I've been the speaker for a webinar, even though I have attended many. So you'll have to excuse me if I'm a little nervous also, because I like to present when I can see people. So this is, but it's also an opportunity because then people don't have to fly into Oahu to be involved. And thank you to PBRRTC for inviting me to come and explain about DCAB services. I am the planner and ADA coordinator at DCAB. That's the abbreviation we use for Disability and Communication Access Board. And I've been working with the agency since 1988. And it's a little unusual because actually our statute for DCAB started in 1999 because we changed our name. When I first started in 88, we were called the Commission on the Handicapped, and we were connected with the President's Committee on Employment for People with Disabilities. We were the state liaison, and we worked through the governor's office. And through the years, it's changed, and we are now connected with the Department of Health, and we work as an attached agency with the Department of Health. And when I started taking calls at DCAB, one of the first questions I always got was, well, what is DCAB and what does DCAB do for the community? And we don't offer traditional services like people signing up and becoming clients. What we do is we do a broader scope of services where we give people technical assistance. So most of the time when we work with people, it's over the phones. That's our first contact with people. And people at first called us and asked, well, where can I get my wheelchair repaired? Or how can I get a wheelchair? I'm newly disabled and I don't know how to access services in the community. So one of the first things we started was a key to resources, which is up on our website now. And that's based on categories and subject matter issues such as equipment, such as advocacy groups, because we just got a broad range of information related to services for people with disabilities in the community and included that in our key to resources. But technically we don't have any clients. We serve anyone that calls our office to ask questions. So we have state agencies that call, we have people with disabilities that call, we have parents who call, and anyone can pick up the phone to call us, and we will provide information and assistance to them as we can, because our staff is very diverse. So let me go in and explain more about DCAB and how we came about. So we were established legislatively as DCAB in 1999 through Act 282 from the Hawaii State Legislature, and we started on January 1st, 2000 under our name DCAB. And prior to that, as I told you, we were the Commission on the Handicapped, and then we had changed our name again to Commission on Persons with Disabilities, because as we moved on, we wanted to focus more on people and not on disabilities. Okay, so primarily the services that we provide are policy analysis. We do blueprint review, so we work with a lot of architects in the community. But when we work on issues that relate to people with disabilities, we do have people in our office that work specifically on disability issues. And as I go through and tell you how our office is organized, I can tell you who the calls are referred to. Okay. And so for right now, just looking at the board, technically we are a governor-appointed board. We have 17 members appointed to our board. Currently, we have one position vacant, and our board has to be comprised of 51% people with disabilities, parents of people with disabilities, or guardians of people with disabilities. And also each county is represented on our board to make sure that when we look at programs and services, we know that it is impacting people statewide. And our board is responsible for developing a plan of action for what the staff needs to do. Okay. And our next slide talks more about the board functions. Because we are a systems advocate, and that means, I know last month you had Hawaii Disability Rights Center come and talk, and they are individual advocates for people with disabilities when they call in, when they feel they're discriminated against. Ours is on the other end. A systems advocate is somebody that goes into the state legislature or to the city and county or to the federal government and provides either testimony, or we develop legislation that impact people with disabilities. So we're on a broader scope than just focusing on one individual's concerns. So we try and make it better for the entire population of people with disabilities. And to do that, we establish guidelines such as for developing accessible buildings and facilities within the county and the state. And that's handled under Hawaii Revised Statute, Section 10350. And we have to, and if the law doesn't cover anything, because 10350 is specific to ADA accessibility guidelines, and if the guidelines don't address some issues, then we have a committee on our board that also looks at developing what we call interpretive opinions, so that people can, so that we in Hawaii have a way to establish standards for people that are not included in the law. So we can go beyond the Hawaii law in that, and beyond ADA sometimes. Okay, and we can also develop alternate designs which would provide for greater access for people with disabilities. For example, one of the issues that we were working on at the legislature this past year was electric vehicles, and we wanted to include the parking spaces for electric vehicles, for example, that included the charging stations, put the charging stations at a height that was accessible for people with disabilities. So that's how we're involved with those types of things. We also have administrative rules on sign language interpreters and captioners that work with people who are deaf or hard of hearing. And our rules are established primarily for state agencies to use, but it gives good guidance because sometimes people don't know what it means to hire a qualified interpreter. And so we set in our rules what qualified interpreter means by way of certification and or holding a credential, because some people don't want to be nationally certified. They want to be locally certified because they're going to stay in Hawaii and work in Hawaii. So our agency also does a local screening test, which I'll talk more about later. And so with our rules, that involves that. And We also are responsible for administering a statewide program to issue parking placards for persons with mobility disabilities under Hawaii Law, Chapter 291, Part 3. So in that, we also, our administrative rules do specific things, and I'll talk about that more later too. In general, our staff mission is to advocate and promote for the full integration, independence, equal access, and improved quality of life for persons with disabilities and their families. We have 18 staff members on board, plus we also have volunteers that come in to work on projects with us. And when I first started, we did have staff members on neighbor islands because we felt that it was more beneficial to the community if people worked in the community that they were serving. And with the first round of budget cuts that came around under Governor Cayetano's administration, the first thing to go were our neighbor island staff. Luckily, we have a very good relationship with the Developmental Disabilities Council, who still has staff on neighbor islands, so we work closely with them. Okay, and our staff in general is divided into several units. We have an administrative unit, which involves the executive director and the administrative clerical staff. We have a unit of one, which is me, the ADA Coordination and Planning Unit. Then we have a unit with 6 staff, and that is the Program and Policy Development Unit. And we have another unit with 6 staff, and that's the Facility Access Unit and the Special Parent Information Network. And so I'm going to describe now what are the goals of each of the units, and then after that I'm going to explain some of the things that we do under each unit. Okay, and so the next slide, I'm going to start with me because I know more about me and what I do than some of the units later on. Okay, in my unit under planning, I work at the state legislature between January and May every year. I also work with emergency preparedness, so I develop an interagency action plan on emergency preparedness. I've also worked with the Office of Election on ensuring that voters have accessible polling sites. And I also conduct trainings, and the trainings I conduct are primarily on those topics that I just mentioned, as well as in ADA for state and county government, and that would be Title II under ADA. And the next unit is called the Program Policy Development Unit, and what we do there is we address we do programs and needs assessment for what kind of needs that there are in the community for different type of services and resources for people with disabilities. And one of the things, for example, that we have done there is, since there was a need with finding resources, that's why we developed our Key to Resources. That responsibility has been transferred over to the ADRCs, the Aging and Disability Resource Center with the Executive Office on Aging, as well as one of our staff people went over and works out of that office now. We also offer technical assistance through the Program and Policy Development Unit, which means that usually while I handle technical assistance calls also, I work with primarily the ADA coordinators, the state and county coordinators, and the technical assistance that the Program and Policy Unit works on are from people with disabilities. And the reason we have it divided up this way is so that if there is an issue, if there is a complaint that comes to the state, one person doesn't take the complaint from both the ADA coordinator and from the person with a disability, because that would be hard for that person to be a neutral party between both the state as well as the person with a disability. The next thing this unit does is also work on communication access. We have a deaf staff person who works on developing a local screening tool to work with interpreters, and also to give the test, to administer the test for people who want to become interpreters. We also have lists, we keep lists of communication access providers. And then the last responsibility for the unit is to maintain a statewide database of persons holding parking permits for people with disabilities. And so we work closely with the counties on that because we have an agreement with the county that the county will issue handicap parking placards. And that last year we started doing a mail-in renewal program. So the public is totally confused here because first they go to the county to get their initial blue placard, and then when they want to renew it, they get a letter from us and say, send your old placard to us and we'll send you a new placard. So, but people are getting used to it now. And our next unit is called the Facility Access Unit, and they have a very big responsibility where all of the construction plans for new and renovated county and state buildings are handled by them. They review all of them for compliance under 10350, as I told you, and they monitor and develop codes, standards, and other building designs for access of persons with disabilities in state and county sites and facilities. And we do have a member of our staff that serves on the Statewide Building Code Council to ensure that the building code is also going to include accessibility guidelines for people with disabilities, because we have learned through the years that if you build a facility in an accessible manner, that saves money, so that later on if somebody comes in and says, I couldn't get into your building or there's no handicap parking space, it costs more money to change the building back so that it will comply to the code in the beginning. And our final unit is the Special Parent Information Network, and this is an important component of our office. We have 2 parents who have children with disabilities that have gone through the public school system, so the parents know how to navigate through the Department of Education to get services for students with disabilities. And they have a warm line that they use to assist parents when parents call in to ask, well, my student did not get services. In fact, I handled a call this morning that was about a parent that was dropping off their child, their disabled child at school this morning, and they couldn't, they were told they couldn't park in the accessible parking space. But so I'm going to work with the ADA coordinator to get that problem resolved, because the issue here is that there was a sign there that said it was faculty parking. So if it's faculty parking, that's not actually public parking. So although the person has a parking placard, they would not necessarily be entitled to park in that space, because that space is assigned to a person with a disability. So we're working on that issue to see if there's another way that the Department of Education can provide that parent with a parking space. Okay, and so we like to get parent involvement. So the Special Parent Information Network has a committee that works with them, and they recruit parents to work with them, and they conduct an annual conference whereby they offer special, actually they offer sponsorship for the airfare so that parents and teachers from neighbor islands can come over and participate in the annual conference. Okay, so now we're going to get a little bit more complicated as we go and talk about civil rights and citizenship goals that we work on within our action plan. And so what we're trying to do here, and what is my primary responsibility, is to have the state and county actually comply with the ADA. And even though the ADA was passed in 1990, we still have some issues that we are working on. And when it was first passed, we had a lot of lawsuits related to the building not being accessible. And now I've noticed through the recent calls that I've gotten, we do get a large bulk of calls related to service animals, and service animals being allowed into buildings, because the government officials responsible for entrance into buildings, there are a lot more security stations at the entrances to state and county buildings. They want to know how to identify a service animal. And the the ADA is written so broadly that there's not a requirement for a license or a certification of the service animal. So the person doesn't always want to let the animal in with the person with a disability. So that's an issue we address. Plus website accessibility. More and more people have access to the internet, and more people are calling to ask why, what are the guidelines so that a site can be accessible for people with different types of disabilities. So we just had a training session at the end of May where we brought in a consultant to conduct a workshop on website accessibility, and we're working with him to come over, and that one was primarily for state and county ADA coordinators and IT people, and we're working on getting him to come back to do a series for private for-profit agencies and nonprofit agencies that also have websites but may not have the resources to or they may not even know how to create an accessible website. So we're going to make that available to them. And also we work cooperatively with other agencies such as the Hawaii Civil Rights Commission, because there was a bill in the session also to clarify how to identify people in housing who are bringing in service animals. And the laws under housing are different than under ADA related to service animals. So that's always a challenge when two federal laws, and in this case it's 3 federal laws that are different, because it also involves the Air Carrier Access Act for people traveling on airlines. Because in housing and on airlines, it still says service animals, meaning different species of animals, where ADA, with the recent changes in the rules in 2010, ADA specifically now says service animals are dogs. So when you go into a restaurant or a hotel, your service animal needs to be a dog under the ADA. However, under fair housing and under the Air Carrier Access Act, your service animal could be any type of animal. It could be a monkey, it could be whatever other types of service animals that people had developed, because I know people had used pigs because pigs live longer and they're more sanitary than dogs sometimes. So even though we don't think of pigs as being sanitary animals. So it just depends. And a lot of things when we're working on service animals initially in Hawaii, we had to look at the quarantine laws, because there is quarantine here. There's still quarantine, although for service animals now, we had worked with a bill at the legislature that service animals, if they meet certain requirements, can have direct release and they don't have to go into quarantine. So we do many different things at DCAB. Okay, let's see. We also worked with the vocational rehabilitation for the past 2 years of the legislature to get a bill passed about providing funding for a service called Newsline, which is a radio reading service that reads newspapers and magazines for people who are blind or visually impaired that can get services. So that was an important component of access for people with disabilities. Okay. All right. And our next slide is still about citizenship rights and civil rights and citizenship activities. And under this part, we offer trainings. We offer monthly trainings through webinars for ADA coordinators through the National ADA Network. And this is primarily to keep ADA coordinators aware of the changes that happen under ADA, because as I said, there are a whole new set of rules that were passed in 2010, and it involved things from agencies that sell tickets to buildings and facilities to service animals to all kinds of different things. So we do monitor those types of disability legislation at the state, county, and federal levels, and we make comments on them. And under employment goals, we have we work with vocational rehabilitation. We work with state employers to provide opportunities and trainings for them as well. We do get a lot of calls from hotels and restaurants asking mostly service animal questions, but also about hiring people with disabilities. So we do have staff people that go out and do training related to Title I of the ADA and providing reasonable accommodations for people with disabilities so they can do their jobs. Okay, and we review and provide comments also on vocational rehabilitation's 3-year plan. The next slide, also on employment. We provide technical assistance to state employees who have questions about reasonable accommodation and whether or not and what types of reasonable accommodations they can ask for. And I usually work with the ADA coordinators when they get that request because they're working from the other end to find out what would be reasonable for them to provide for employees. And we conduct, as I said, we conduct trainings at intermediate levels. And what we try and do for ADA coordinators is use case studies so that it's not just providing information about the law, but actually assisting them to use the law and understand it. And we also encourage employers to look at all employees, including people with disabilities, when they hire people for vacant positions, as well as promoting people in current positions, because we all have needs when we're working that we just don't want to stay and do the same thing for year after year, and we want to work and improve ourselves as employees, so we try to encourage employers to promote people with disabilities. Okay. And I was talking earlier about communication access, about interpreters. For a long time, we worked on increasing the number of interpreters in Hawaii. That's why we offer a statewide screening for sign language interpreters. And just within the past few years, though, we have had a lot more interpreters available in the community, especially in the city and county of Honolulu. On neighbor islands, there's still not as many interpreters, but if you know of anyone who wants to become an interpreter, if there are 2 or more people that want to take the test, we will bring the test to you in your county. So that would be helpful, particularly for Maui and Kauai counties who have fewer interpreters than the rest of the counties. I do know that the Big Island in Hilo, there are a number of interpreters, local interpreters, as well as interpreters from the mainland that have moved. But because we have so many interpreters here now, because we used to have what's called a interpreter service center that used the internet and that did interpreting via interactive means over the telephone using video relay service, and that service went out of business 2 years ago. And so all of the interpreters that were employed there are now back in the community doing independent contracting. And so there are more interpreters available now than were before. Okay. And the next slide is I'm talking more about the credentialing. Usually for credentialing and certifying of interpreters, nationally certified interpreters come from the Registry of Interpreters for the Deaf, and they take a national test. And interpreter certification doesn't mean that, like for example, one of the things that the National RID does is they use the terms master and advanced interpreter and just a regular interpreter, and those are different levels. And it doesn't necessarily mean that they're the top interpreters, because it also depends on what and who the person with a disability wants to work with and who they understand. So sometimes the deaf people don't just want to work with somebody that's certified, but they want to work with someone that they understand, and they have the right to do that. So even though there may not be any credentialed interpreters in your community, there may be somebody that the deaf person feels comfortable working with, and the interpreter works with both the deaf and the hearing person. And in the majority of cases, the hearing person, the agency, is the entity that pays for the interpreter. So the interpreter has to be providing services that are satisfactory for both the deaf and the hearing person. So you want to talk to all parties involved to see whether they understand the communication that's happening. And our staff person does go out and conduct trainings, and she just did a training on the Big Island, I think, and on Kauai earlier in the summer. So we do have the capability of traveling around to the different counties. So if you want someone to come out and talk about not only sign language interpreter, but about captioners and about educating consumers how to use interpreters, she's able to come out and do trainings for you. And what we're in the process of doing, since we did bring a consultant in to look at, to talk about accessible websites, we felt we had to practice what we were preaching. So we asked him to look at the DCAB website and give us feedback about how accessible our website was. And we are working with him to correct some of the deficiencies that he saw in our site so that we can be a model and promote web accessibility, as well as just conducting workshops about how other people can do it. We want to also show other people that we can have an accessible website also. And so we're updating our website, and we will probably be having a new website, I hope, in October sometime, that presents more accessibility to everyone in the community. Also, as I said before, we talked about the rules for communication access, and we do provide a recommended fee schedule. We could not set a fee schedule because that would be price fixing. So although you see prices on our website attached to different certification and credentialing levels, you can negotiate with interpreters. And we primarily set these because prior to having any type of fee schedule, interpreters were just charging agencies whatever they could get. So we had some people charging several $100s for like a 2-hour job, where at least with a recommended fee schedule, we feel that we have set some kind of minimum standard for people so that they don't feel like they're getting overcharged for services. Okay, but as I said, you can negotiate with people. And just to let you know, for neighbor islands, because there are fewer interpreters on the neighbor islands, sometimes their fees might be different from what we suggest that is charged. But in most instances, I feel that interpreters have stuck to the fee schedule we've recommended. Okay. Okay, and we try and offer the state credentialing test as often as we have interpreters for them, and I think we offered the test at least 3 times last year. Okay, if you have questions about it, feel free to call our office and talk to Jacob and Christine about it. Okay. Continuing on with communication access, it also involves other things like use of the telephone. And people who are deaf actually, oh, we're on the next slide. Okay.
There we go.
Okay, people who are deaf actually use the telephone, and not as many people use the TTY as did previously, because now we have relay systems where people can call you through a video relay operator. So they're going to call you using a sign language interpreter now. I don't know if any of you have gotten calls that way, but it's a lot faster to use an interpreter on the phone than to type your messages out and then read typing back to you through that service. But through the telephone company, the telecommunication relay service, that interpreter service is free for you as an agency. However, if you decide to go with VRI, which is video relay interpreting, those are run by private companies, and they could charge you a different fee scale. Because I know we've had some people that have been trying to set up a VRI, interpreter services, here in Hawaii, and so their fee schedule is a little bit different. And it's based on the VRS through the phone company is based on people making phone calls. So it's you calling a deaf person and not having a TTY, or a deaf person calling you and over the relay service, so they can get those services for free. But if you want to offer a meeting, for example, and you can't get someone to interpret in person, you can use remote video interpreting, and in that case you would get charged a charge for that. And those fees are also different than having an in-person interpreter working with you. And also you see on the slide I put up some symbols for accessibility. The phone with the keyboard, that's the symbol for TTY, and we have a sign like that outside our office so deaf people coming in know that we have a TTY, so they could use a TTY in our office. And the OC that you see on the other side of the screen, and the CC. CC is something we see all the time with TV because that means closed captioning, but OC means open captioning. And I think in Hawaii people are more used to seeing open captions because if we're watching our Korean shows or our foreign Japanese shows, we see the captions coming up for everyone, and that's called open captioning. And so that's what our office likes to promote, is open captioning, because then it's accessible for everyone, not only people who are deaf and hard of hearing, but people that may not understand English or are learning English as a second language. That's a backup for their language development too. So, but a lot of people like the closed captioning because you can turn it off. I personally like it because as I'm getting older, I don't always hear all words clearly, so when I'm watching TV, sometimes I turn the captions on myself just to use them and be sure I got the message right. Okay, we're going to move on now to parking, and some of our parking goals are to issue parking placards, as I said, and first-time placard holders can get them from your local county offices, the blue placards and the red placards. Now, under federal law, we can't charge for parking placards, where before we charged an administrative fee to issue the placard, but now people who have their doctor sign off on their application form that they're permanently disabled can get a parking permit. And my office would probably kill me for calling it parking placard because it's supposed to be a parking permit for persons with disabilities. We're trying to train people how not to say handicap parking placard anymore because the more politically correct way to say it is parking permits for people with disabilities so they can use the accessible parking spaces. And under this program, what we try and do is design accessible parking spaces at private and state and county agencies so they conform with federal requirements for design, how large the stall is and how large the access aisle is, to put up appropriate signage, and also that the parking spaces are enforced appropriately. Because when people don't display their placard or they're parking in the space without a placard, just to run in for a minute, because the parking space is closer, you can get a ticket, and the parking fine for parking illegally in a handicapped parking space, in an accessible parking space, is $250 for the first violation, and then it can go up as high as $500 for parking in an accessible space illegal. So we want to be careful not to do that, and we're working with the police department in the various counties on enforcement, because we know that that's not one of the top priorities of the police department because they are our safety officers. But when people are parking illegally in spaces, we want to ensure that the parking spaces are enforced so that people learn not to use the spaces if they're not entitled to. Okay, and going on with that parking spaces, our parking program, just to let you know, the number of placards that we have is on an annual basis, we do issue about 32,000 placards. So it's not a small program. We have 2 people in our office that do that with 1 senior volunteer. So, and they work on the placards all day long, getting them in and getting them out since we do the renewals there. And just so you know, even though you don't have to pay for the blue placards when they're first issued to you, if you lose it or it is mutilated or damaged and you go in to get another one, we can charge for a replacement placard. And because the federal law does not say we cannot charge for the red placards, which are for temporary disabilities or disabilities that last up to 6 months, we can charge for those placards. So the counties do charge, and the county, the way the law is set up here and the memorandums of agreement that we have with the county keeps the funding that is collected for the temporary and replacement placards that they issue. Okay, and currently on our database we have about 70,000 users, because what we try and do is we try and work with Department of Health to get death certificates and death records, and so we send out notices to people's families when after they've passed away, so that we can collect their parking placards back. Because what we found out prior to doing that is that people will their parking placards to family members, and so the family members were using them although they didn't have a disability. So we don't want to encourage that to happen anymore, so we try and get the placards back from people, and they've been very very forthcoming in doing that. Because what we do in the letters, we say, you know, call our office, let us know if you do have the placard, and we'll send you a return, you know, envelope so that you can send them back to us, and so that we can destroy those placards and get them out of circulation. And so through doing that, we want to promote the proper use as well as work with the enforcement program with the county police departments so that the stalls are enforced. Okay, and we recently also did, last month we did a 30-second spot to instruct people on, and we showed them on TV. We brought primetime TV space so that we could show the spots to educate people about the appropriate use of accessible parking stalls. Okay, now moving on to community living and support goals. We work with a full range of community agencies, both state and private, in working to develop information and providing policies related to persons with disabilities and services that they receive. And we also go out and promote self-determination and natural support systems for people with disabilities. And we also promote quality, improved quality of care for people with disabilities in the community. And one of the things that we have worked on related to that are our Home for Life task force, where one of our staff members worked with a group of people to develop programs and designs for homes so that people can age in place in the community. And also I work with the Deaf and Blind Task Force to develop state laws and programs that will serve people with disabilities, people who are deaf and hard of hearing, in a way that's more appropriate for them, because people with who are deaf and hard of hearing communicate primarily using American Sign Language. And so we're trying to support getting care providers that work with them who know some sign language so they can communicate with them directly and not through a sign language interpreter. And the next slide is on community living and supports. One of the programs that takes up an extensive amount of time with my job is working with State Civil Defense and Red Cross in developing a plan, an interagency action plan, so people with disabilities are also included when people are notified of a disaster, and when we develop our individual shelters for people to evacuate to ensure that they're accessible. Because a lot of times when people think about disasters, they're not thinking about serving the whole community. And one of the new concepts that are coming out of the Federal Emergency Management Agency, FEMA, is to include people with disabilities from the planning process onward, so that people with disabilities are included in emergency evacuation procedures. And one of the committees I sit on is the Region 9 FEMA working group, the Functional Needs Working Group. And the person that is the staff person for FEMA Region 5 is coming to Hawaii the first week of September. So we're trying to work with him on some activities, because he is a person who uses a wheelchair and he has a service dog. So and this is going to be his first trip to Hawaii, so he's very excited about coming here. So hopefully when we get a group together to meet with him, the people that are interested can also meet with him, because he's a very good resource to the community. And we also provide assistance with I serve on an advisory board with the University of Hawaii Center on Disability Studies, who has a new program that's been in effect for about 3 years now, and it's called Feeling Safe, Being Safe, where trainers who have developmental disabilities or intellectual disabilities are trained to go out and be trainers to teach other people with disabilities and their families how to be prepared in case of an emergency. And that's been a very successful project, and we have even developed a phone app called TIPS, which provides basic information about disabilities. In fact, one of the categories that we do not currently have on our disability list is traumatic brain injuries. But when we develop the app and we work on a second round of information, we are going to include people with traumatic brain injuries on that list too, because when the police or ambulance workers come and work with the public, they work with different types of people with disabilities. So we want to ensure they have basic information, or they know where to get basic information about different types of disabilities. And we modeled the program after a program that was set up in at Texas A&M and in New Mexico. And so we kind of copied their basic information first, and they did not include people with traumatic brain injuries. But we want to make sure that when we get our app up, we do include that information. And we have seen tremendous growth in the trainers in that program, where before they were not very communicative. And now that they are trainers and people are asking for their services, they've really blossomed and really feel that they are contributing something to the community. And we're very proud of that program. So I think the University of Hawaii has done a really good job with emergency preparedness and people with disabilities in that aspect. And from DCAB's perspective, we also do technical assistance, not only with ADA, but related to Fair Housing Act. And we do take technical assistance call about the Federal Fair Housing Act, and we also include that as one of our accessibility guidelines that we review to under the Facility Access Unit. Okay. And the next slide is very brief, and we are working with Community Living and Support, but we work with the QUEST, the Medicaid program, and also with State Olmstead Plan, because we were initially involved with developing the Olmstead Plan for people with disabilities to get back into housing in the community. And I don't want to shortchange the Facility Access Committee and the Facility Access Unit and what they do, but they review county blueprints and state blueprints to ensure ADA compliance and compliance with federal fair housing if it's a public living facility. And one of the things I wanted to let you know is they do have 6 staff people there, and just to let you know the amount of work that they do, they reviewed almost 1,000 plans, but they reviewed 889 plans, and that's annually they do that. which include 530 new plans as well as 356 plans that were resubmitted after they were initially reviewed. We issued one interpretive opinion and one master plan. We reviewed one master plan and a pedestrian master plan for the Kaka'ako area, and they published 10 access e-bulletins, and we also served, as I told you before, as a member of the State Building Code Council to ensure accessibility in the new building code that's going to be developed. And the next slide is, I think I'm on the next one after that one. And we reviewed two state county access design requirements. We established those as well as review state and county blueprints, and we analyze building codes. And I apologize that some of these slides are kind of repetitive because I kind of put two PowerPoints together when I was developing it. And one of the things the Facility Access Committee also does is they provide technical assistance to architects and design professionals by fax. People fax in their questions, and we responded to 756 fax questions that were related to design and accessibility for facilities. And we conducted one Design for All conference, and we provided a training on public rights-of-way and a training on medical and diagnostic equipment and accessibility, and 8 additional workshops on the new 2010 accessible design standards with the Facility Access Unit. And for our last unit, the Education and Training unit, we wanted to make sure that parents are informed about their rights in getting their students through Department of Education, and to promote appropriate services and inclusive education for family-centered practices. Okay, and so I told you in the beginning when I talked about the SPIN parents that the two of them did, last year they did 1,204 technical assistance calls to parents on their warm line, and well, not only calls but also emails, and they maintained a parent website, and they published 4 quarterly electronic newsletters. Okay, and if anybody wants a newsletter in print, we will also send them print copies of any of our newsletters. And they sponsor an annual SPIN conference, and they also work with the State Plan for Special Education and work with the Department of Education to ensure that they are following goals and guidelines set up by the Individuals with Disabilities Education Act. And they also conducted 2 trainings for families of children with disabilities and 4 trainings for educational personnel in various schools. And just so you know, if you are on a neighbor island and you would like to call us, we have our phone numbers here so that you can call us or send us an email. And from neighbor islands, we do have, as a state agency, we have toll-free numbers, which include Lanai and Molokai, which is a 1-800 number. It's 468-4644. And you can call and ask for DCAB with the Department of Health. From Kauai, you just dial this number directly. You don't have to dial 1-800, and this is true for the rest of the counties. From Kauai, it's 274-3141, extension 68121, and then you hit the pound key at the end. And from Maui, it's 984-2400, extension 68121 with the pound key. And from the Big Island, it is 974-4000, extension 68121, and the pound key. And I didn't leave too much time for questions, and I don't know if anyone has any, but feel free to type in any questions.
Well, I don't see any questions. This is a good time to type questions in if you have them. But you mentioned that most people call over the phone as the first contact. Would it be okay to email DCAB in order to make first contact?
Yes, you can email us. Our email was on the previous slide. It's DCAB at DOH, Department of Health, Hawaii, and you spell it out, .gov, G-O-V. Yes, you can email us, or I've also included our fax number on here. If you wanted to send a fax, you can do that also.
Okay.
Raised hand.
Oh, it looks like one of our participants has their hands raised. Do you have a question? Okay, if you type a question, we can answer it. You've got our attention.
Have you handled any calls related to individuals with TBI this past year?
You know, usually I'm the person that gets the calls from people that if they have a question about traumatic brain injuries, and I don't recall taking one this year. I have gone out to do presentations for the TBI support group at Rehab Hospital because usually Lena Burian has our contact information, and she's also an architect, so she knows about facility issues. So I've gone out to present to their support group on the ADA, a general overview, as well as I've presented to them twice about preparing for emergencies, getting your Go Kit ready, and some of the things you need to do, and also how to find your the closest shelter to you. But people with traumatic brain injuries might also be interested in the feeling safe, being safe training and becoming trainers, because through the grant at the University of Hawaii at the disability at the Center on Disability Studies, they actually do pay trainers, certified trainers, when they complete a training. I think it's $50 a training, and they provide the materials, the handout materials. And I think that people with TBI might be interested in becoming trainers, because a lot of the materials that they use are larger print, and they have a large refrigerator magnet where people can put information for first responders on their refrigerator, like who to call, what kind of medications that they're taking, etc. So you might want to give Dawn Skaggs at the University of Hawaii a call, because she's the person that is responsible for that program. And I even know her number if you'd like it. It's 956-9797. And if you're on the neighbor islands, you have to dial the area code first, 808.
I want to go back to talking about service animals for just a minute. And I know that when I've looked at definitions of service animals in other states, they have a definition and requirements for training and things like that. So as I understand it, we don't have any definition like that in Hawaii?
No, not in Hawaii state law. We pretty much follow what they have set up in ADA, which the definition in ADA just says that the animal needs to be trained to provide a service that's specific to the person's disability. So if it's a person who is deaf, that the dog alerts them that somebody's trying to call them from the back, or that they're getting a phone call, or somebody's at the door, or if somebody there are a whole range of service animals. So if there's someone who has problems with balance, the dog, usually it's a larger dog, but the dog can help them regain their balance before they fall. Or someone who, I know I just spoke to somebody with diabetes who wanted to get their animal trained, but it reminds the person that they're insulin, so the dog is aware of a scent or an odor from the person because they are low sugar at a particular point, so the dog reminds them to eat a snack or to take their insulin. And so there's several alert dogs that do work with people with different types of disabilities.
We have a question up here. It says, people with disabilities may not be able to give a signature, so can they use a fingerprint instead of a signature? They already use this kind of system in the bank.
You know, I haven't ever had anybody that asked me that question, but certainly a signature I mean, a fingerprint would be better than an X. Usually if somebody can't sign and they use an X, somebody can witness the signature of the person. So I don't know if it would be easier to use a fingerprint or...
You'd certainly need to have specific technology for
Right,
that.
right.
So, and the comment goes on to say there are lots of forms to fill out that need a signature. And that's very true. I think the agency that you're working with, though, would really need to have the kind of electronic equipment to be able to help you use your fingerprint rather than a signature. And that might be a drawback right there.
And I can follow up on your question and then get back to Robin here, and then she could email out the information.
Yeah, that sounds
people.
great. Well, I am sorry to say that we are at the end of our time. It's 11 o'clock, and I want to thank everyone for participating. I want to thank Debbie for giving us so much information, and remind everyone that they can call DCAB regardless of where you are in the state, or email for information and assistance. And this means anyone. You don't need to be a person with a disability. It can be your family members or friends if they have questions or they need assistance. So thank you, and thanks for taking part, and we'll, with any luck, be talking with you again in the future. Aloha.